Earlier today, Cuyahoga County officials were notified regarding the healthcare worker who traveled through Northeast Ohio and flew out of Hopkins International Airport before showing symptoms of the Ebola virus. Earlier today, while it was still actually in the morning hours, I directed that we activate our Cuyahoga County Emergency Operations Center to provide any assistance that is needed for our constituents. We did that at approximately 11 a.m. Right now, members of the county staff are providing on-site assistance also at the Cleveland Emergency Operations Center. And we're going to continue to assist with outreach and communications efforts to local governments across Cuyahoga County at this time. Cuyahoga County is and will continue to coordinate with the Ohio Emergency Management Agency, the Summit County Emergency Management Agency, and the Cuyahoga County Board of Health regarding the actions that we need to take to ensure the health and safety of Northeast Ohio residents. And my office is going to continue to provide information as it becomes available. I have with me, behind me, some of the professionals that have dedicated their lives to responding to these kinds of crises and have trained for these types of unfortunate events. I have with me Terry Allen, who's the Health Commissioner for the Cuyahoga County Board of Health, Walter Topp, who is part of our team but is the administrator of our Department of Emergency Management, and Ken Mills, who's our Director of Public Safety. And I'm going to refer the balance of this event to them. So at this point in time, I will turn it over to our Health Commissioner, Terry Allen. Terry.
Thank you, Ed, and thank you for being here. So you folks are aware that what we know now is that we have an individual that traveled and spent some time here in Northeast Ohio. And so we want to first make a note that we understand that people are concerned and that people are anxious. We recognize that. So it's important that we have the facts when we think about our families and our friends and our coworkers, and we're dealing with the facts and what we understand about this virus based on several decades of a response that have occurred across the world and information that we get directly from the Ohio Department of Health and the Centers for Disease Control. We work on the facts and we work on the science. We've been working closely with our local medical partners in the hospital systems here in Greater Cleveland. We have a very strong medical system. They've been following the guidelines as they've evolved from the Centers for Disease Control. So it's important that people recognize that there are very explicit guidelines on what hospitals need to do, and our hospital systems here and the strength of our hospital systems I think is an important asset, and we've been working very closely with them and will work closely with them in this response. We also have been working with our local health department partners, the City of Cleveland Department of Public Health and Summit County Public Health in the response. We need to understand that we've been going back many years, even post 9/11, to West Nile virus outbreak, the H1N1 outbreak that occurred in recent years, and that we're used to these response mechanisms, working closely with our County Emergency Management Agency and working closely with our state health department and CDC. That's how the system's supposed to work, and that's how the system's going to work here in the United States, here in Cuyahoga County and in Greater Cleveland. We have plans in place to handle these types of situations and are confident that they will work. We've been doing emergency planning and preparedness for almost 15 years now, working with our safety forces, working with our emergency management agencies and other public health agencies in our hospital systems in terms of preparing for response. Public health understands how to track diseases and how to work with the community in response. We'll continue to monitor the situation closely because it's important to know that this information is just hours old. So we're working with Summit County Public Health as they begin to ascertain, along with the CDC and the State Health Department, who the close contacts are. We need to understand who the close contacts are because we need to do monitoring of those close contacts. And that means taking twice daily temperatures of these close contacts. We need to then monitor them, check for temperatures greater than 101.5 degrees, and look for other symptoms along with that fever that may include vomiting, diarrhea, muscle aches, a range of symptoms associated with Ebola. But it's important to know that if people don't have symptoms, that they cannot transmit that virus. It's also important to know that this is not an airborne virus. This is a blood and body fluid transmission. So that's an important hallmark of this situation to understand. So we're talking about saliva, sweat, blood, vomit, and urine to be very candid in terms of transmission. It's not spread through casual contact or in the air. If you happen to walk by someone in an airport or in a hallway, this is incidental contact and is not considered a contact of concern. So we have levels of contact. We have high-risk contacts, people that have come in contact with blood and body fluids of people with Ebola virus. And we have casual contacts and people that may have spent some time but did not come into direct contact with, spend time with the case but did not come into direct contact with blood and body fluids that they're aware of. So the contact tracing piece will be where public health will become involved and be working closely with our partners. We do it in lots of infectious diseases, contact tracing, identifying people who have been exposed and people that they may have been exposed. This is what we do, and we're prepared to respond. There's been a lot of misinformation out there, and it's important that we stick with the facts as we go forward. So what you'll see in the coming days is a unified response with emergency management, hospital systems, and public health departments here in Northeast Ohio at the state level and at the Centers for Disease Control. We also want to note that there's information available to people in terms of concerns. If you think you may have had a close contact, the 1-800-CDC info number is available to you. The Summit County Public Health Department has a hotline at this point, and they're serving as a point for information at this stage, and the situation is very fluid. Please understand that day to day, as we learn more information and as we talk with the families, that we'll learn more information about who could have been exposed and what we need to do about it. So please understand the situation is fluid. So the number right now we're working with for local information is 330-926-3939. You can expect in the coming hours and days a unified public health incident command system along with emergency management. This is what we do. We know how to respond. And so we want people to give us time to understand the nature of the situation and understand that we'll be doing contact tracing of those individuals that are identified to have had close contact with the case, and that we will be periodically providing information back to the public as is appropriate. So those would be my comments. Thank you.
I want to turn the podium over to Ken Mills and Walter Topp from Emergency Management, our Department of Public Safety. Gentlemen.
The Department of Public Safety is currently working to support the Health Department with their actions in setting up a unified command. We're currently operating in the EOC with the City of Cleveland to establish that structure, the incident command structure, so if in the event it did expand, we're able to act as one and facilitate a response for all of us to work together. Walter Topp, the administrator of OEM, is here. He's been in the EOC, and I'll turn it over with where we're at.
Hi, I'm Walter Topp. I'm the administrator for the Office of Emergency Management for Cuyahoga County. We activated our Emergency Operations Center today around 11 a.m. This allows us to bring in our full staff. It allows us to gather information, to make notifications, to provide information to municipal and regional agencies, and to work closely with the Departments of Health, the Board of Health for the county, and also the City of Cleveland's Office of Emergency Management and the City of Cleveland's Division of Public Health. We have provided information to municipalities. We've been in contact with Ohio Emergency Management Agency multiple times today. We have sent, currently we have 4 of our staff members over at the Cleveland Emergency Operations Center. The City of Cleveland currently has the lead for this event. The City Health Department and the city's Emergency Operations Center, that's the incident command post. We're providing, our EOC is activated. We're in support. So any kind of assistance we can provide, we're happy to do so. We have, the county is also participating in the Joint Information Center, which is very important because it's critical that all the agencies involved speak with one voice when we put out information to the public. And so the county has someone participating in that as well. We're going to continue to monitor the situation, provide updates to municipalities and our regional partners, keep Ohio EMA informed, and through them, the Ohio Department of Public Health, and again, as I say, provide whatever support we can to the incident commander. Thank you.
I would just add that county government has really prioritized emergency management response and preparedness. We've been working on that for a number of years. This is the kind of circumstance that these gentlemen prepared for. They're professional and they're prepared. We've given them the resources that they need to respond to these kinds of things, and I'm quite confident that they're going to be able to do that. Situations like this do not respect geographic boundaries or jurisdictions. They have to be dealt with in a unified and coordinated way, and in using a regional approach is really the only rational approach when it comes to dealing with the public health emergency, and we're committed to doing that, and that's how we're handling that, and have been handling it all day, and will be until this situation is abated. Any questions or comments? These gentlemen can take questions for you for a few minutes if there are any.
What's the status of Cleveland Hopkins Airport right now?
So the City of Cleveland, and refer your comments to the City of Cleveland, I believe that they reported on the status, and that would, since they run the airport, I would refer all questions or comments relative to Hopkins to them.
Any other questions?
Have you learned anything from Summit County and Akron and Kent officials?
We in public health in Northeast Ohio work very closely together. Many of us have been working together for more than 20 years. And so I feel that it's important to note first that we have very strong relationships with them. They are very busy at the moment, doing what they should be doing in terms of contact tracing. We will be periodically in calls well into the future and into the evening, working with Summit County, the City of Cleveland Department of Public Health, and the Ohio Department of Health to ascertain close contacts and make decisions about what we need to begin doing now in terms of identifying close contacts to begin our monitoring of people who may have been exposed. So this is the situation. So they are helping us to begin to understand from the family in Akron what needs to happen first in terms of identifying people that we need to prioritize for assessing exposure. And so that's happening now.
What should people do if they're concerned about this?
Well, I think that what we're talking about now is making sure that people are informed and understand how Ebola is spread. We've talked about the fact that this is not airborne. We know that they're concerned, but understanding that to date, we know the folks exposed here in terms of those that have actually contracted Ebola. Here we have a person who was in West Africa, who came here to the United States with Ebola. And we have 2 people that had very close contact with the patient, caring for that patient day in and day out. It's also important to note that there were individuals in the household with that individual who was Mr. Duncan, who, very unfortunately and sadly died. And those folks to date have been monitored and have not contracted Ebola. So it's important to understand we have close contacts, just the 2 people in healthcare, and they're now revisiting the personal protective equipment and the work that happened in the hospital system to assure that they can prevent exposures. It's a very difficult situation for them, but people should understand that casual contact in terms of passing somebody in the hallway or passing somebody in the airport is not a risk for exposure to Ebola.
What about shaking hands with somebody or patting them on the back or that?
Right, so that sort of contact we need to assess. That's close contact. It's inside of a 3-foot zone. We need to assess those, and those would be ascertained based on conversations with the family, whether those contacts occurred, and those folks would be monitored.
Are you concerned that this patient was allowed to travel even though she treated him with Ebola?
I think the CDC has spoken to that fact already, that they've expressed their concern about that.
So you mentioned contact tracing. Is that happening with your agency as well in Cuyahoga County?
Right, so the role will be is right now, we will be working closely with our public health partners to talk with the family and understand the close contacts that have occurred, and that's happening now. Based on the information that comes from that, there may be close contacts that we have to follow over time, but this case identification and those that may be at risk, that is happening as we speak, and it will continue to happen in the coming days. That is, again, a very fluid situation, but we are prepared and understand our role in contact tracing as it may occur in Northeast Ohio, and that's the way we're looking at this situation right now, out of an abundance of caution.
Where is that taking place when you're talking about contact tracing?
So contact tracing is working with individuals as it's happened in Dallas, where they're identified as an exposure of concern. They're tracked 21 days once we've identified them as an exposure of concern, taking temperatures. as the hallmark and indicator of whether there's been an exposure. So that will be taking place based on contacts, and then public health staff actually monitoring individuals' temperatures twice daily, 21 days, if they are a close contact.
I presume this patient is showing symptoms now, may become more visibly ill later, but presumably a lot of the information will be coming from that patient. What did you do in the airport? Where did you sit? Who did you sit next to?
Right, so contact tracing and understanding that would be, when we deal with contact tracing and all kinds of infectious diseases, is you need to talk to the individual or family members or other known close contacts to understand the movements of that individual. So that process is taking place as we speak to understand the scope of movement and those that they may have been in contact with, in close contact with.
Thank you for your questions. We will make information available as we get it. We appreciate your role in making sure that accurate information gets out to the public. The Emergency Operations Center is open and operational. It will remain so until, again, as I said before, that this situation has come to a close. But thank you for coming today, and appreciate our partners here and their participation. Thank you.